Hello, welcome to our presentation. Today we will be speaking about PVD. The term Hello, welcome to our presentation. Today we will be speaking about PVD versus PAD, presented by Noemi, Quirino, and Shauna, Paige. Please enjoy.
The term peripheral vascular disease may be used when referencing peripheral venous disease or peripheral arterial disease. However, the two disease processes are not the same, and some nursing interventions are unique to each one. In this presentation, we will highlight the differences between the two. Peripheral venous disease, also called peripheral venous insufficiency, is a problem with the veins that prevents them from effectively bringing blood back to the heart. This may be caused by an obstruction in the vein or reflux of blood from the valves, usually resulting from high pressure in the vein, causing it to stretch the vein and damage the valves. Peripheral artery disease, or peripheral artery insufficiency, is a problem with the arteries in which they become occluded and prevent delivery of blood and oxygen to the extremities. Signs and symptoms of peripheral venous disease include pooling of blood, edema due to the blood pooling, discolored, dry, cracked, itchy skin on the extremity, aching, throbbing, or cramping pain, dilation in the superficial veins, also called varicose veins, resulting from faulty valves. Varicose veins may rupture and cause stasis ulcers. The ulcers seen in PVD are found typically on the inner or outer ankle or the anterior tibial area. They are often more superficial than those seen in PAD and tend to have irregular borders and granulation tissue. Signs and symptoms of peripheral artery disease include intermittent claudication. This is the primary indicator of PAD. It's aching, cramping, weakness, or fatigue in the distal muscle group from the occluded area. It is brought on by exercise and relieved with rest. In more progressive cases, the patient may have impaired mobility due to pain. Pain while at rest indicates severe ischemia of the distal extremity. This pain is typically worse at night and is aggravated when the extremity is elevated. The patient may experience relief when the extremity is in a dependent position. Peripheral pulses may be diminished or absent. Skin may be shiny and dry, and extremities will have a dusky red color in the dependent position or pallor when they're elevated. Extremities tend to be cold due to the lack of blood flow. Deep circular ulcers may occur, often on the tips of the toes, toe webs, or heel, and gangrene occurs from long-term tissue ischemia.
Now let's dive into the pathophysiology to better understand how these diseases interrupt the systemic circulation and cardiac activity. We know that veins and arteries work together to assure the body has adequate blood circulation. Veins work by taking blood back to the heart, arteries work by taking blood away from the heart. Focusing on the pathophysiology of PVD, we now understand that this disease causes blood pooling, which can occur in any part of the body, but is more commonly seen in the lower limbs. The mechanism of venous return in PVD is the following. The body has two vein systems in all limbs, the superficial and deep vein systems. Both systems have valves that help push the oxygenated blood back to the heart. When the valves do not work, this causes the blood to flow back down towards the ground due to gravity and the damaged valve. We call this blood pooling, referred to as varicose veins. Here the arteries are working fine. The issue is with the venous return. Now let's talk about the mechanism of PAD, which is more commonly a result to atherosclerosis, narrowing of the blood vessels due to plaque buildup caused by excess of cholesterol. The liver creates two types of cholesterols, LDL, low-density lipoprotein, or HDL, high-density lipoprotein. LDL is harmful cholesterol that causes plaque buildup in the arteries. HDL is the good cholesterol that works by transporting LDL from the bloodstream back to the liver for elimination. Too much LDL in the bloodstream can lead to hyperlipidemia, which can later result in plaque buildup, atherosclerosis, causing restricted blood flow. Having the heart work harder to compensate for the narrowing arteries can lead to health conditions such as heart failure, heart attack, or stroke, just to name a few.
Here we'll discuss the risk factors for PVD and PAD. For PVD, the risk factors include ages above 50, family history of PVD, female sex, history of DVT, obesity, pregnancy related to hormonal effects, and sitting or standing for long periods of time. Risk factors for PAD include smoking, which is the most important modifiable risk factor for peripheral artery disease due to the vasoconstrictive properties of nicotine. Others include a poor diet, which contributes to hyperlipidemia and atherosclerosis, hypertension, diabetes, stress, an inactive lifestyle, elevated C-reactive protein, which indicates damage of the blood vessels. Non-modifiable risk factors include female sex, people over the age of 60, a family history of PAD, and lastly, the risk is higher in African Americans than in other ethnicities.
Now your NCLEX question. A 50-year-old woman weighs 95 kilograms, has a history of tobacco use, high blood pressure, high sodium intake, and a sedentary lifestyle. When developing an individualized care plan for her, the nurse determines that the most important risk factors for peripheral arterial disease, PAD, that needs to be modified are The correct answer is C. Significant risk factors for peripheral arterial disease includes tobacco use, hyperlipidemia, elevated levels of C-reactive protein, diabetes mellitus, and uncontrolled hypertension. The most important is tobacco use. Medical diagnostic test. The following tests are used for both PVD and PAD. Treadmill testing assesses for claudication and duration patient could walk without altering ankle systolic pressure. AVI testing assesses differences in BP between the ankles and arms. Duplex ultrasonography differentiates between arteries and veins in a grayscale imaging and evaluates flow of distal vessels. CT scan with contrast and MRI provides better visualization of vessels.
Here we will discuss the medical management for PAD and PVD. Pharmacologic therapy includes antiplatelet agents to prevent blood clots such as aspirin or clopidogrel, statin therapy to lower cholesterol and improve endothelial function, antihypertensive drugs such as ACEs and ARBs for patients with PAD and hypertension. Less invasive procedures to improve arterial flow in PAD include balloon angioplasty, stents or stent grafts, atherectomy, and for severe cases, bypass grafts to reroute blood flow around the occluded or stenosed vessel. PVD and varicose veins are treated with surgical ligation, microphlebectomy, thermal ablation, and sclerotherapy.
Nursing diagnoses for peripheral vascular diseases. Let's keep in mind that the nursing diagnoses are dependent upon the underlying process and nursing assessment data. 3 possible nursing diagnoses are the following. For PAD, we have ineffective peripheral tissue perfusion related to interruption of arterial flow. For PVD, we have ineffective peripheral tissue perfusion related to venous status. The next 2 nursing diagnoses apply to both PVD and PAD. Impaired skin integrity related to vascular insufficiency, and lastly, impaired physical mobility related to activity restriction of therapeutic regimen and pain. Nursing interventions for PVD. When there is a problem with the veins, elevating the legs in short sessions during the day and at night is encouraged to help decrease edema. 15 to 20-minute sessions is recommended. This provides relief and promotes venous return to the heart simultaneously. Compression socks help elevate the pooling of the blood in the veins and promotes venous return to the heart. It's recommended to remove the socks twice a day, assessing conditions of the extremities. Skin located in the affected extremities should be monitored routinely for ulcer formation. Skin kept clean, dry, and free from trauma. Nursing interventions for PAD. In the case of peripheral arterial disease, it's recommended to lower and keep extremities below the level of the heart. This position promotes blood flow to the tissues. If not contraindicated, keep the muscles active, also stimulates blood flow and develops collateral circulation. Remember, the tissues are not receiving blood flow and oxygen, which means they are susceptible to trauma, infection, and even amputation. Adequate hygiene helps to maintain skin integrity. Feet should be monitored for ulcers, kept clean and dry, keeping the patient and their extremities warm to ease vasodilation and arterial flow. If chills continue, a heating pad may be used on the abdomen to stimulate reflex vasodilation in the extremities. Caution: direct heat to the ischemic tissues may cause trauma.
Patient education may differ based upon the underlying disease of the patient. Foot care, exercise, and a healthy diet are important factors for both venous disease and arterial disease. In PAD, the patient and/or caregiver should be provided education for smoking cessation, avoiding elevation of the extremity, and avoiding cold temperatures to promote better tissue perfusion. In PVD, the nurse should provide education on ways to promote venous return to the heart, including wearing compression stockings, elevating the legs, and avoiding sitting or standing for too long. In both diseases, the nurse should include family in the teaching to promote adherence to the treatment plan.
Patient education. This is a brochure that was provided to our patient upon discharge. It defines peripheral arterial disease, offers risk factors, mentions signs and symptoms, diagnostic tests, medical management, and home care. And additionally, it also includes 2 websites to visit for further information. And this brochure was provided upon discharge to another patient with peripheral venous disease. It explains risk factors, signs and symptoms, diagnostic tests, medical management, and home care.
Okay, guys, it's time for another NCLEX question. Peripheral venous disease can occur due to the narrowing of valves in the veins of the lower extremities. True or false? The answer is false. Peripheral venous disease can occur due to overstretched valves of the veins in the lower extremities. These valves are not narrowed. In addition, it can occur when the veins become damaged.